Understanding Commercial Sex Policy, a Global and U.S. Perspective. This presentation is brought to you by Ivania Grenier, Bianca Fields, Jesse George, Jessica Jones, Kendra Lamb, Elizabeth Ortega, Humberto Ortiz, and Kelly Ulloa. Commercial sex, also known as sex work and prostitution, is the engagement of workers in sexual activity with clients for money or other negotiated goods. While the revenues are high, sex workers have to share their profit with their managers. The public health issue at stake here is the health of these workers and their clients. It is estimated that the disadvantage of commercial sex significantly affect healthcare costs expressed in combating such diseases as HIV/AIDS, syphilis, gonorrhea, and other contagious diseases. Many women that engage in this activity have poor access to healthcare services or ignore the necessity to check their health at all. Unfortunately, the rates of STIs are 5 to 60 times higher among sex workers than in general populations, and these individuals are often unaware of their infection status. This further endangers their own health risks and increases the risk of infecting others. Surveys of female sex workers show that 35 to 55% have engaged in unprotected commercial sex, with 10 to 35% report never using condoms at all. Female prostitutes can average 17 sex partners per week. Only 47% of these women are even aware of their HIV status, and less than half have had a health screening in the previous year. It should be emphasized that the US and global contexts are different with regard to commercial sex. In terms of annual profits, the US accounts for $14.6 billion of the global $186 billion industry. Globally, many sex workers are victims of sex trafficking through force and violence and have access to little or no health care. In the US, sex workers have opportunity for more access to quality care compared to those who are victims of sex trades, especially Africans and Middle East immigrants. Because sex trafficking and sexual exploitation, including prostitution, is mostly an illegal industry in the US, it is not possible to construct a representative sample of those trafficked or otherwise involved. Therefore, traditional research methods are not available to answer the prevalence question. Most of the often cited statistics about trafficking prevalence are estimates from advocacy groups and social providers. Many research projects analyze arrest data to ascertain information about the number of those involved in the sex trade, including buyers, pimps, traffickers, and exploited and trafficked people. Sex trafficking is defined as someone using force, fraud, or coercion to cause a commercial sex act with an adult or causes a minor to commit a commercial sex act. Whereas commercial sex includes prostitution, pornography, and any sexual performance done in exchange for any item of value such as money, drugs, shelter, food, or clothes. Healthcare providers are on the front line for identifying victims of commercial sexual exploitation and sex trafficking. Despite the potential opportunities for intervention, healthcare professionals often overlook or fail to identify victimized individuals. According to the Family Violence Fund, at least 28% of victims have seen a healthcare provider at least once during their victimization. In another study reported, 6 out of 12 victims interviewed reported seeing a healthcare provider for treatment of sexually transmitted infections, testing for pregnancy, and/or abortion services. Lack of adequate training was identified as the key barrier in identifying sex trafficking victims. Other barriers include lack of understanding of commercial sexual exploitation and sex trafficking, lack of policies and protocols for these crimes, and lack of disclosure by victims. In all 50 states and the District of Columbia, healthcare providers are mandated reporters of suspected child abuse. In some states, reporting is only required if the abuser is a family member or caregiver. This leads to most commercial sex exploitation and sex trafficking of minors not falling under the mandatory reporting requirements. For this reason, several states, including Florida, Georgia, and Massachusetts, have passed legislation that includes commercial sex exploitation and sex trafficking of minors by non-family members as reportable forms of child abuse. Trafficking Victims Act is the landmark legislation that catalyzed the modern-day fight against human trafficking. Human trafficking, also known as trafficking in persons, is a modern-day form of slavery. It is a crime under federal and international law. It is also a crime in every state in the United States. Under U.S. federal law, severe forms of trafficking in persons includes both sex trafficking and labor trafficking. Over 31,000 potential human trafficking cases have been reported by the public to the National Human Trafficking Resource Center hotline between December 2007 and December 2016. The vast majority of these cases involve trafficking for sexual exploitation. The National Human Trafficking Hotline maintains one of the most extensive data sets on the issue of human trafficking in the United States. As stated, trafficking for sexual exploitation is of higher incidence, with 6,081 cases reported in 2017 versus 1,249 for labor trafficking. Common venues used for sex trafficking include massage and spa parlors, hotel or motel based venues, and online ad solicitations. Females make up the large majority of trafficked individuals. Again, these figures are only estimations and do not define the totality of human trafficking, as most incidents go unreported. There is a reported high rate of commercial sex use amongst the Hispanic migrant population, with 30% of Northern California Mexican farm workers and 18% of migrant farm workers on the East Coast admitting to contact with commercial sex workers. 44% of 342 surveyed male migrants who returned to Mexico admitted to commercial sex use while in the United States. In one particular study of Hispanic migrants working in North Carolina, it was found that those who used commercial sex workers had a higher incidence of HIV, and 28% reported being very concerned about becoming infected with HIV. 92% report always using condoms with commercial sex workers. However, once they were familiar with the worker, the use of condoms decreased, thus increasing the STI risk. Commercial sex is prohibited in the US and many countries worldwide due to its perceived moral, physical, and psychological damage. However, a range of scholarly studies report that punitive measures are not effective, and there is a need to reconsider policies regulating the work of the industry. For example, a Nordic model of managing prostitution criminalizes the buyers of the service, yet decriminalizes those who provide it. According to Seals in 2015, this model sets no health requirements, which is a concern that makes sex workers unprotected. In its turn, the analysis of Nevada, where indoor sex commerce is legalized in 11 counties, show that women have more opportunities to check their health. This policy requires them to use mandatory condoms, check for syphilis and other STDs, and live in a brothel while working. Thus, while the issue was not addressed by the government, nursing profession contributes to its resolution via the aforementioned policies. A bill called Reducing Criminalization to Improve Community Health and Safety Amendment Act of 2017 was proposed at the Senate level by David Grosso and Robert C. White Jr. regarding Washington, D.C. As in Nevada, it is expected to decriminalize commercial sex and protect the rights of women. For example, this bill proposes that if a sex worker were to be attacked, she should not be afraid to seek health services, as there would be no threat of being arrested or charged with prostitution. While it is currently under consideration of the state Senate, the outcome of the legislation is not clear. Since there does not exist a current proposal of broad legislation with regard to commercial sex, it is possible to hypothesize the potential scope. First and foremost, it should be stressed that the issue is extremely complicated, stigmatized, and multifactorial, which makes sweeping policy difficult to achieve. One may assume that there is a need to research all states and identify the attitudes of citizens, survey the number of brothels existing illegally, and conclude with a clear vision that of each state. The example of Nevada, where only indoor commercial sex is legalized, seems to be effective, as sex workers are protected from violence, have a negotiating process, and periodical health checks. This is sufficient to address the problem. Therefore, partial legalization and decriminalization may be discussed as potential legislative agendas in the U.S. contexts. The funding would be provided by both government and local authorities. If the given issue remains unaddressed at the government level, there is a risk of increased incidence of STDs, client violence, and vulnerability of the sex worker due to fear and inability to seek health assistance. These unintended consequences would likely manifest as additional burden to healthcare costs. Moreover, the human rights of sex workers may be violated, as they would continue to have poor access to care and fear being arrested. If the Nordic model were to be applied, clients would still be illegal, which may affect the profits of sex workers as well as their ability to pay for housing and other lively needs. Additional unintended consequences of decriminalization commercial sex may be the increased number of brothels and sex trafficking through intimidation and coercion. The groups that may be affected are sex workers, clients, nurses, and the members of society with an active position regarding the given issue. If sex workers continue to maintain poor access and limited rights, they would be deprived of basic rights of education, pursuance of adequate pay, and livelihood. The clients would be stigmatized and repressed, leaving few opportunities for these women. Nurses would be overwhelmed with addressing STDs and potential psychological traumas. Increase in demand for brothels and sex trafficking may also affect women engaged in this service. Liberals, unions, sex workers, sellers, political advocacy groups, Amnesty International, and the World Health Organization support the idea of decriminalizing commercial sex. The supporters of the proposed bill about decriminalization would provide such arguments as making sex workers safer and reducing abuse and discrimination. These groups claim that prostitution is work, and like any job, it should guarantee certain rights and legal benefits. Its abolitionists are the majority of feminists and conservatives who believe that commercial sex is offensive by its nature, and it causes inequality between men and women. They view prostitution as an exploitative exchange that brings no positive issue to sex workers. Therefore, congresspersons and Senate representatives with liberal views should be targeted as policymakers who can affect the development and introduction of the proposed bill. In order to follow the money trail, it should be stressed that the introduction of the new policy may require significant spending from the government and local organizations, but its expected outcome seems to be much more important. Issues requiring further exploration. Is there current research that evaluates commercial sex impacts on health, access to care and services, cost, and quality of care? What are the advantages and disadvantages of having brothels with regulated prostitution in the U.S.? Does there exist effective policy for which legislation can be modeled? What are the barriers, limitations, and any other concerns encountered by nurses in their care for sex workers, such as STDs, intimidation, fear of arrest, and psychological traumas? Some anticipated questions in regard to a potential bill include how commercial sex decriminalization would impact costs and quality of care for sex workers based on special insurance options, how decriminalization may affect sex workers and their clients in terms of safety and violence, what are potential nursing implications of prostitution decriminalization in U.S. brothels, what issues may require additional costs. In order to answer these questions, it is critical to survey and conduct interviews with the groups involved in the commercial sex industry with an aim of creating an in-depth understanding of the issue. In conclusion, commercial sex is the industry in which primarily women sell sex services and men purchase them. This makes the first group vulnerable due to the current criminalization laws. The example of Nevada and Nordic countries show that legalization and decriminalization seem to be more effective compared to the current U.S. regulation. There is a need to protect sex workers from violence and give them access to health services, while their clients should be also viewed without stigma. This concludes our presentation with references available for your review.